Good afternoon, everyone. Welcome to Emory's MCI Dementia webinar series. We are so glad you could join us today. The webinar is part of an educational series that is sponsored by Georgia MemoryNet, the Integrated Memory Care, the Emory Cognitive Neurology Clinic, and the Charlie and Harriet Schaffer Cognitive Empowerment Program. Each month, we have a different topic that relates to cognitive health, dementia care, support, community resources, just to name a few. The previous webinars have been recorded and can be viewed on a link that will be placed in the chat. I am Alice Cooper Salisbury, one of the licensed clinical social workers in the Cognitive Neurology Clinic. I am joined today by my social work colleagues, Jenny Gay in IMC and Debbie Arnold in CEP. Before I introduce our speaker for today, just a few housekeeping details. This is a webinar format, which means your cameras are off and your mics are muted. We do want you to be able to ask questions of our speaker. So there is a Q&A box where you could submit your questions throughout the presentation. And we will save time in the end for our speaker to answer them. Please note, you do not have to wait until the end of the presentation to submit your questions. So now a little bit about our speaker today. Anita Alvarez Richards is a former Georgia State Health Insurance Program Medicare counselor and has counseled Medicare beneficiaries and their family caregivers, as well as individuals aging into Medicare since 2005. She continues to train through the Center for Medicare and Medicaid Services. She is passionate about issues that affect older adults and their caregivers, and she provides information and resources to better assist them. She is going to be speaking on Medicare today, so we welcome Anita. Thank you so much for joining us, and I'll turn it over to you.
Hi, I want to thank you all for allowing me to come and provide this valuable information to you. Medicare changes every year, but yet this year it looks like we're going to have quite a few changes. And I just want to let you know what all is involved. Right now, we are in the middle of open enrollment. It started October 15th, and it is going to go through December 7th. I can't say that enough. I highly recommend that you all, however, look at your options before Thanksgiving. And I say this every year. The reason being is Thanksgiving comes and there's like a week between Thanksgiving and December 7th, and you forget about it. And then before you know it, you're stuck in the same plan that you were already in, or you don't have a choice to move on to something new and better for you. So I'm going to go ahead and start with Medicare and tell you what it is. What is Medicare? Medicare is a federally funded health insurance program. It is for people who are U.S. citizens or resident visa holders who have lived in the United States for 5 consecutive years. It is for people who are over 65. For some people who are under 65 with certain disabilities, it's for people of all ages with end-stage renal disease, which is permanent kidney failure that requires dialysis or a kidney transplant. And it is for people who have received Social Security disability for at least 24 months. Now, one thing that confuses people a lot is they think that Medicare pays for everything. Medicare does not pay for everything. Medicare pays for part of the cost for medically reasonable and necessary healthcare services. So Medicare has an 80-20 rule. Medicare pays for 80% of the services they allow, and you, the beneficiary, pay the other 20%. And there are ways that you can pay for that. You can either pay for it out of your pocket, or you can get a secondary insurance. And I'll talk to you about that a little later. It is important to know, though, that Medicare does have an 80-20 rule. Now, there are 4 different parts of Medicare, and you may have heard these letters. There's Medicare Part A, that's going to be your hospital insurance when you're admitted into a hospital. Medicare Part B, that's your medical insurance for any type of outpatient service. Medicare Part C combines A and B. That's going to be the Medicare Advantage plans. You see a lot of commercials about that on TV right now. Lots of different companies are saying, go with us, go with us. We'll cover all your Medicare services. And then there's Medicare Part D. That's a standalone prescription drug plan. You could have A and B and D. And I'm going to tell you what your options are. So your two main coverage options, or you can do what's on the left side of the screen. I like to call this a la carte. You'll have original Medicare, which is A and B. We call that original or traditional Medicare, depending on who you're talking to. In most cases, you'll want to get a Part D prescription drug plan. Now, if you're on TRICARE, you don't need to get a standalone Part D plan, but some people choose to. You want to look at your options to see what all TRICARE covers. Now, a lot of people want to get a secondary coverage. You might do this through Medigap, Medicaid, maybe your employer or union, or again, maybe TRICARE. If you don't want to do that, you can do what's on the right. And this is what we're seeing all the commercials about. Medicare Advantage plan, MA plan, Part C plan. Some people even call them supplemental plans. These are going to be bundled plans like HMOs and PPOs. Most of them are going to include Part D drug coverage, but not all of them. And when you get a Medicare Advantage plan, you don't need a Medigap plan, and you cannot be sold a Medigap plan. So your choices are to do what's on the left, or you can do what's on the right. Now, what does Medicare Part A and Part B cover? For your hospital insurance, it's going to cover any hospital inpatient care, but not observation. So if you've ever been into the hospital and maybe you're in the emergency room, or maybe they're just looking at you to do some testing or screening, but they have not formally admitted you, that could be under observation. In that case, Medicare Part B is going to cover it until or unless you are formally admitted. And your discharge planners on the floor should be able to help you understand if you are admitted or not. It's also going to cover any skilled nursing facility inpatient care, but it is not going to cover long-term care or custodial care. So it will not cover a home care aide to come into your home and do laundry and meals and services like that. It will cover drugs that are part of your inpatient care. It will cover home health care. Home health care is going to be if a physical therapist comes into your home, or an occupational therapist, or even a nurse. It's going to be intermittent. It could be 2 or 3 times a week. It could be 15 minutes to 45 minutes. It is not going to be long term. It's going to cover hospice care and blood if you need a blood transfusion after, I think it's 3 pints of blood. Now, Part B, this is your outpatient medical insurance. This is going to cover services that you get from doctors and other healthcare providers. It's going to cover any kind of outpatient care, whether it's a hospital outpatient or observation or emergency room. It will cover home health care, again, not private duty custodial care. It's going to cover durable medical equipment like walkers, wheelchairs, hospital beds, and other equipment that your doctor or provider may order for you. And it'll cover preventative services like screening, shots, vaccines, your yearly wellness visits, and more. If you have your Medicare and You 2026 booklet, there are several pages in there that tell you about the preventative services that Medicare Part B covers. For kidney transplant recipients, you can keep limited Part B coverage for life, to cover immunosuppressant drugs, and full Part B ends at 36 months after the transplant. Now, some of you may be hearing that starting in 2026, Medicare is going to require prior authorization. That will not be in Georgia. This is going to be a pilot that they are going to start regarding wasteful and inappropriate services reduction. So it will be in 6 states. None of those states are in Georgia, so you do not have to worry about prior authorization for 2026 unless you move out of Georgia into one of the 6 states. Advanced care planning. I'm not sure how many of you all have your advanced directive, but I highly recommend getting one done. Medicare will pay for you to meet with your doctor or your provider to discuss your options for care and considerations of your decisions ahead of time. Let the people in the hospital know what your preferences are if you are not able to speak for yourself. Get a power of attorney for healthcare. Tell us what your treatment options are. Do you want to be put on a ventilator? Do you want to have CPR done? Do you want to have tube feeding? Things like that. It is important to talk to your provider and your healthcare team about what your wishes and your wants are. And it's a great time to do it during your annual wellness visit. Medicare Part B immunization coverages. I'm going to tell you guys, I thought COVID was done until I got it this summer, and I was deathly ill with COVID and the flu at the same time for 5 weeks this summer. I did not think I was going to make it. I encourage everyone to get their vaccines and boosters. Part B covers the following vaccines as part of Medicare covered preventive services. Get that COVID-19 vaccine if you can. If you have a Medicare Advantage plan, you pay nothing if you get the shot from an in-network provider. Get your flu shot, the hepatitis B shot, and get your pneumonia shot. Now, the following vaccines are going to be free to beneficiaries enrolled in a Medicare Part D or a Medicare Advantage plan with prescription coverage. That's going to be your Hep A shot, your Hep B, which is 2 shots, the RSV